All right, guys, what is going on? Happy Wednesday. For those of you who don't know me, my name is Christopher Medina. I am the hearing aid specialist here at Virtue Hearing Aid Center, and I am your hearing care professional. So today, we have my buddy here, Shannon, who's gonna, just talk to us, help me with this conversation. And today's topic is going to be about Medi-Cal insurance. So Medi-Cal insurance here in the state of California, specifically in the Los Angeles County area, it's a low income program, right? That everybody has. And some people have hearing aid benefits through that program. So you guys might be asking, hey, my friend, my family, maybe even yourself have hearing loss and you have Medi-Cal insurance and you want to know how to get started. What is the process? What does my insurance cover? All those little details, because, it's kind of a big process, but it's totally worth it because, as we all know, hearing aids can be, a pretty good investment, especially, when it comes to your hearing health. So
talk to us. What kind of plans? What does it cover when you're on Medi-Cal? How does it affect you?
So the first step is to, go into your hearing care professional's office. Show your insurance benefits, which in this case we're talking about Medi-Cal. If you have Medi-Cal, what we do here is we verify the insurance to let you know what benefits you do have and what benefits you don't have. So if you're looking for hearing aids, we're gonna check if if you qualify for hearing aids. If you do, then we're gonna keep moving along with the process. So first, let's talk about the plans here. So when you first apply for Medi-Cal, you are probably going to have regular Medi-Cal. What that means is there is no health plan. It's straight Medi-Cal insurance. And when you have straight Medi-Cal insurance, you are more likely able to go anywhere you want. You can go see any doctor. You won't have any issues. They'll bill your insurance. You're all covered. It's all good. But a couple years back, they started a new law where you have to choose an insurance. And if you don't choose, I'm pretty sure within I think it's like a 3-month grace period. If you don't choose, they automatically enroll you into an insurance plan. Some examples can be HealthNet, LA Care, Molina, DHS, and I'm pretty sure there's more, but those are the most popular ones.
And which one covers hearing aids?
So when you have regular Medi-Cal, it covers hearing aids.
Okay.
Now, here at our office, we only take specifically the HealthNet plan, but you also have to have Medicare. But Medicare is a whole different ballgame. Let's just leave that out of the picture for now. We're going to focus only on Medi-Cal. So we just recently discovered this plan that I believe is called DHS that covers hearing aids. You can come to our office. We'll do the hearing test. You don't even need, I believe you don't even need medical clearance with that plan, which is great. Now, if you have any other type of insurance like LA Care, we're talking about the health plan. If you have like LA Care, Molina, HealthNet, and you don't have the Medicare part, then you're probably most likely going to have to go to your primary physician to request an authorization to probably go see an ENT doctor or an audiologist. So that can be a process in itself.
And is there any cost when you go to an audiologist?
No. So when you go see your primary doctor, they request that authorization. If it gets approved, then they give you the referral. You get your appointment. You go to the next office, which is the ENT doctor or the audiologist, to go get cleared for hearing aids. You get medical clearance for hearing aids, because they first need to check to make sure if your hearing loss is being caused, by, let's say, for example, earwax, maybe an infection, something that can be treated, then that's what they want to medically clear first, for example. Now, if there's nothing they can do, then they're gonna clear you for hearing aids, and with that clearance, your insurance will cover the hearing aids. Then you can go to your hearing care professional, whether if that's a dispensing audiologist or a hearing aid dispenser like myself. So that's kind of the process of how that works. If you guys have questions, comments, comment below. We'll answer them for you. Send us a message, stuff like that. So that's basically the process.
Okay.
And we do take Medi-Cal.
Now, what? Sorry to cut you off.
No, go ahead.
What hearing plans does those cover? Because I know you said you had 3 hearing plans: the standard, advanced, and the premium versions. Now, if I have Medi-Cal, what kind of hearing devices does that cover? Does it cover the down payment? Does it cover, what specifically does that?
Definitely. So the truth is, Medi-Cal is only going to cover whatever's going to get you by. So they're not going to cover you the most premium level technologies. Most of the time you are going to get the most basic, which, hopefully you can go back to one of our technology video tips. That way you get to know how many technology levels are there with hearing aids, but you're going to get the most basic, which is still going to help you hear better than having no hearing aids at all. You're still going to be able to have a better conversation, be more aware. It's just going to help you overall either way. So you are going to get a basic level. I'm starting to fit Medi-Cal patients with hearing aids that actually have Bluetooth connectivity to direct to iPhone cell phones only. Now you could get connection to Android, but then you have to buy a separate accessory, which most patients are probably not going to want to buy. So that accessory is going to cost $300 to $500. You might as well buy yourself a new iPhone, right? So there is, at our office, there is a little bit higher technology, like something that has Bluetooth connectivity direct to iPhone, and stuff is getting better every single year.
Now, does it, let's say I want a premium hearing device, would Medi-Cal, would it cover the difference or not at all?
See, with Medi-Cal, it is a low-income program. Therefore, you
can't buy the Ferrari.
Getting these benefits because you're supposedly low income. So you cannot say, hey, I want the premium technology, let Medi-Cal pay some portion of it, and then I'll take care of the rest. It just doesn't work that way. That would be
probably under investigation.
It would be a fraud. It'd be a fraud because then you're saying that you have money, but you're not reporting it to Medi-Cal. Therefore, we cannot do that. We cannot say, hey, well, Medi-Cal will pay this, you pay the difference, and you get the best.
Okay.
Unfortunately, with specifically only Medi-Cal, we cannot do that. So now there is different insurances that do allow you to do that, but hopefully we're going to break this insurance thing into different segments because there is definitely a lot to talk about when it comes to insurance. Because there's Medi-Cal, there's Medicare. Medicare has their own plans, their health supplemental plans. There's private insurance. There's, as you can see, there's a lot of topics. So we don't want to confuse everybody. We want to make sure we stay on the Medi-Cal topic for today and in this video, whether you're listening to on the podcast, Instagram, Facebook, whatever favorite social media platform that you're on, we're gonna just talk about this. So yeah, guys, if you have any questions, let us know. I'm trying to think of other things that we can talk about Medi-Cal. So just real quick, going over through the process again. Let's say you come see us, we will verify your insurance. If your insurance is good, we will have to refer you out to an ENT doctor or an audiologist for medical clearance, most likely an ENT doctor, to get medical clearance for hearing aids. With that medical clearance, you will bring that back to us. That gives us clearance to bill the insurance for hearing aids. So they will see the test, they will see the medical clearance that you need hearing aids, then they will pay. Now that process can take up to 45 days, even longer sometimes. So I just recommend you be a little patient because, we do have a lot of patients that get upset over the time, and I understand. It could be, stressful waiting to get your hearings approved. You want to wear them. You need that help. So it does take up to 45 days. Sometimes it takes longer for them to give us back an answer, but typical bidding takes 45 days.
Okay, perfect.
That's good. Okay,
that's good information.
Cool. So thanks, guys. We're gonna do this in Spanish. Make sure, hopefully, we get people who speak English and Spanish, get to understand and get a little educated on the whole Medi-Cal insurance stuff. Okay. Thank you guys for watching. Post in comments, and we'll try to answer as much as we can. We'll catch you guys on the next episode. Outie.